So today we will be talking about a rectocele, which is an issue when the pelvic floor muscles become weak. This can cause a lot of pressure and fullness, and patients can complain about symptoms. A more detailed description of this is a bulging at the front wall of the rectum into the back wall of the vagina. It can often not produce symptoms. Sometimes it can produce symptoms in the vaginal and rectum. So kind of important to be able to decipher between these, including some of the other things that could be like a rectocele, such as a cystocele or an enterocele, which is where either the bladder also protrudes down or the small intestines protrude down, and that could produce similar problems in these type of patients. Causes of the rectoceles is thinning of the rectovaginal tissue or weak pelvic floor muscles. This can happen predominantly a lot of times when women give birth, multiple deliveries, large babies, things like that. Chronic constipation can be a cause. So rectal surgeries and or hysterectomy could cause some damage in there and cause your pelvic floor to become weak. Symptoms as far as vaginally, they can have a feeling of pressure or fullness in the vagina. They can complain of pain during sex. They can have some vaginal bleeding, not during their menses. Rectal symptoms could include some constipation. If they're having a bowel movement and they're unable to fully push it all the way out, so they have to kind of stimulate their anus to get it out, straining with bowel movements, things of that nature. Diagnosing these patients, full physical examination with history. You can perform a digital rectal exam, an anorectal manometry, colonic transit study, or a balloon expulsion test. I found it interesting that a balloon expulsion test is they insert a balloon into the rectum and then you're asked to evacuate it. It's a way to stimulate and simulate the process. And the amount of time that it takes you to release the balloon has a lot of diagnostic information. This definitely helps with one of the diagnostic, tools to help diagnose this. Diagnosing it also, a defecography, which is an x-ray test that shows the rectum and anal canal as they change during defecation. Very specific, and it kind of watches the process as the colon and rectum are entered. This is pretty diagnostic and obviously a radiological study. So probably one of your last studies that you would complete if you were unable to make a diagnosis prior to this. Treatment, education regarding bowel function, diet, laxatives, pelvic floor rehabilitation using biofeedback. I found this really fascinating to read about. So our smooth muscles and all the muscles in there kind of perform together to help contract and relax and to get all that out. And so they have found that if you can go to, it's called a kind of pelvic floor rehab, they can stimulate and kind of get the biofeedback working again versus some surgical interventions. And sometimes a lot of the candidates that have the need for this are too old to undergo like a full-on surgery. So that's something that could be available to them if surgical intervention wasn't a good choice for them at that time. And that is all I have on that for you. Thank you.